One. Hi, everybody. Welcome to the last day of lipedema awareness. And we're trying to, spread the word and about lipedema. And I have this great guest slash co-moderator presenter, Trish, who is a lipedema warrior, and she is going to share her story. And I think that so the topic is putting it all together, the conservative and surgical treatment. And Trish is a perfect example. So it really, I mean, I think slideshows are boring, can be at least, and then having Trish to bring a real life perspective to it really makes it better. And so, without further ado, we're gonna begin this. Those are my disclosures, and I have a couple of questions mixed in, and I'd like if you guys watching at home or wherever you're watching to answer these questions. And the first question is, when was Lipedema Awareness Month started? And you can text or make a comment and put your answer in the bottom. So this Trish has graciously agreed to let us use her photos so we can make it even more real. And thank you so much for that. And I'm gonna this is Trish when she first came to my office. And I just want to her photos really show classic signs of lipedema, and you can see in her right here at her ankles that this is called the cuff sign or Turkish cuff, and you can see there's sparing or no enlargement at the foot, and then the tissue has enlarged, and that is classic for lipedema. You can see the mattressing of the skin, the sort of nodular appearance to the skin over her thighs, and the subcutaneous tissue overhanging her knees, and the lobules on her arms. And the overall proportion is her legs have more enlargement than her trunk, and that's classic. So Trish has been a healthy, active person her whole life, and and even being active and having a healthy lifestyle, she still struggled with this. And so now I'm gonna let Trish take over and talk, share her story.
Yeah, absolutely. So I would say lipedema for me, when I really, started to have symptoms, or when I noticed, I was early teenager. I always played volleyball, and was very active in middle school, high school, and things like that. I was always, I was never overweight, but I was big boned. So that's what I attributed big bone to being. Was, I had no ankles. I couldn't put knee socks, for volleyball team up to my knees. It wouldn't go up. My mom took me to the hospital or the doctor for leg pain. I always had severe leg pain. I don't know if that is attributed to lipedema or not, but it was always just a difference with my legs. And even the doctors agreed, but no one could ever figure out what it really was. I would say it probably really increased and really got worse with the lipedema fat after my pregnancies. An indicator, I had very hard, it was very tight skin as well. Nurses or doctors would always rub my legs, but they would never know what it really was. So that was one of the big indicators. Another indicator is I would lose weight. I lost 30 pounds at one time, and the circumference of my legs got bigger. So they actually grew in the lipedema area. So, not always, where you can lose weight is what made a difference as well, for me to know that something was different. I was on the internet one day, um, and I found a group, lipedema group, and they had pictures, and it looked just like my legs, it looked just like my body. And it really intrigued me. I showed my husband, and he agreed as well. He's like, what is it? Is it, treatable? What can we do? Because I had very severe knee pain. And it came at a time when, I'm pretty active with my children. We go kayaking, we bike, and things like that. And, my biggest thing was I just wanted to be mobile. I wanted to be there and be active with my children, before it got worse. So, that was my focus. So, the lipedema group, they kind of had it laid out on what you kind of need to do, the process of where you need to get, and the treatment. I seen a vein specialist first. He cleared me there, but he knew something was wrong. So he, told me I could do whatever I needed to do, and he could help me in any way. So he referred me to a doctor here, locally, at OSU, and he was able to diagnose me with lipedema. He was very knowledgeable on it, and kind of helped get me started with compressions, with all the treatment and things like that that I needed. And then that's kind of how I got to Dr. Wright, was, kind of searching different doctors. And Dr. Wright was just very focused on the patient, and he's very knowledgeable about lipedema, and about treating it, to your body, in a healthy way. And so that's kind of my story of, how I got diagnosed, kind of my whole process, and what I noticed different. I would say one of the key indicators too for me is, that it was hard was I don't have anybody in my family that has lipedema, or any kind of symptoms or signs. My mom is super small. She's 4'11". She weighed 100 pounds top her whole pregnancy. So I have a lot of smaller people in my family. So that was always different to me, and hard to recognize what it truly was. So that's my journey, and that's how I got to Dr. Wright.
Well, I actually thank you. That's a great, thank you for sharing your story there. And it really is very very common. And so I do want to kind of make a point, is that 40 to 60% of women with lipedema have a family member, that close family member that has lipedema, but that means 40 to 60% don't. And so it is inherited for some, but not everybody has a first degree relative. And so don't, if you don't have a close family member, that doesn't mean you don't have lipedema. Yeah. So great. Thank you for that. So I want to talk a little bit about conservative treatment of lipedema, the non-surgical, and this is essentially the anti-inflammatory diet and compression garments are the two main pillars of our non-surgical management. So anti-inflammatory foods are low processed foods, especially limiting refined carbs and processed meat. So we're going to get into certain things in the diet can aggravate lipedema and cause the inflammation to increase, especially like refined carbs. Almost everybody with lipedema, if they consume a lot of refined carbs, will get some worsening of their symptoms or increased swelling, that sort of thing. So they're especially limiting bread, sugar, pasta, rice, corn, potatoes, and those things. And then compression is a key component of reducing the inflammation and controlling the symptoms of lipedema. And compression is poorly understood and poorly implemented in the treatment of lipedema. So, we're going to put a little extra emphasis on compression and how it can help, because I feel like that's an area of need. So this is is a schema showing the lipedema, how focusing on the inflammation, and it does, the inflammation does cycle, goes through ebbs and increases, and that is can be related to diet. I mean, Trish mentioned as Trish explained to me that she noticed dairy made her swelling and pain worse. Can you share a little bit about that, Trish?
Yeah, absolutely. So, it's trying to find what works for your body, and what causes that inflammation. Dairy was big for me. I've reduced that tremendously. Carbs, especially the sugar piece, is a part of that as well. And it's so hard to take all of that out of your diet. So, don't think you have to take it out, but going maybe low carb, things like that has really helped tremendously. Just knowing just being aware, right? And knowing how much you're intaking, and lowering that. And it really does help. If you do that every day, it will make a difference. And I know it sounds cliche and it's easy to say, just take this out or don't do this, but I can't express this enough that if you want to continue to help your lipedema even after surgery, you have to understand the inflammation points of your body, and this is one of them. And you have to get it under control if you want to maintain that low inflammation.
That's great. So I think I want to emphasize a couple points she said. So dairy clearly aggravates her, causes swelling and inflammation. But not everybody
Right.
with lipedema has dairy. It does the inflammation go. So she's really come to figured out for herself that's going to make the difference. Some people, so I do recommend everybody kind of pay attention and become aware, as I say, and then so everybody, some people, it's all can be also sensitive to gluten, but not everybody. And so, you have to, but the overall picture is whole foods, low processed, and that's how everybody, including myself, and I don't have lipedema, I try to eat and should eat, and it is the healthiest for everybody. And so with the compression and the diet, we we want to get the calm down the inflammation. So the inflammation still maybe kind of cycles, but not just much smaller amount. And because there's no such thing as living without any. So, and we do think it's important to do this before surgery. Obviously, we don't want to do surgery, which is a inflammation producing stressful event, to in the middle of a peak of inflammation. Theoretically, it could make things worse. So next question is, can compression reduce the size of legs and lipedema? And that's very controversial. There's a school in Germany, it's not a consensus in Germany, but there's a subset of German doctors who believe there's no edema in lipedema, and that compression pumps and compression aren't necessarily needed, or are only working to reduce inflammation and not and do not reduce the size of limbs of lipedema. And so, sorry, so this brings up a study I just recently published last year about looking at compression devices and compression stocking use in women with lipedema. These are just off the shelf, over the counter compression garments, and spoiler alert, we did see a decrease in limb size, about 2% with the compression stockings, or pantyhose, and then that was about doubled. So up to up to 4, or even at the knee, even more than 4% decrease in size with immediately after the compression pump. So that clearly to me shows that there's a decrease in size, and we did some studies with bioimpedance, and we did show that there was a loss. The difference was a result of a change in fluid, or a loss of extracellular water, which is consistent with edema. So this is another study by Atan 2 years ago in 2021 showed that the compression decreased the pain in lipedema, and also in that study they showed decreased limb size. So another author independently seeing that there was a decrease in size in the legs of lipedema ladies. So here's the summary of all the things that compression does for lipedema. It helps smooth lobules and cuffs, improves mobility, decreases pain. They have an anti-inflammatory property. It decreases edema and limb size, as I kind of showed you. It improves venous and lymphatic function, leading to improved overall health of the skin. And then this is the most important part. It really maintains the benefits of everything. It maintains the benefits of surgery, pumps, or MLD. Yet only 70% of women with lipedema wear compression, and I think that number should go up. I think more women should be regularly wearing compression with lipedema. Women who do wear the compression, 73% reported that they felt supported. It reduced their pain and improved their mobility. That was by a study by Lisa McIntyre in 2020. Switching gears, I want to talk about lipedema reduction surgery, and that is one of the most powerful things we have to treat lipedema. But it's not the same as liposuction. Liposuction is a cosmetic procedure. Lipedema reduction surgery is reconstructive, and its goal is to improve pain, mobility, and multiple measures of quality of life. It's been shown to do that, and that is the reason. It's a large volume surgery. So the average, I've just submitted for publication a series of 500 cases, and the average volume removed is over 5 liters. And up to 13 liters of aspirate was removed in one surgery. We use techniques to protect lymphatics because lipedema ladies have impaired in lymphatics, and there have been reports of lymphatic injury from liposuction. So this is really not every, if you go to your liposuction area guy on the corner, he's not going to use those techniques. It also includes manual extraction, and that manual extraction is removal of these lipedema nodules, those that are still present when after the reduction, and these are fibrotic nodules, and so we'll actually just manually express them after the liposuction's done. So that's kind of the overview of lipedema reduction surgery. So now we're going to go into some of the mobility benefits. And this is a lady with lipedema, and you can see here, this is a long arm goniometer, and this is how we measure. This is the standard way to measure knee flexion, so In this picture here, you could see the green arrow would be where a normal leg would be, the normal lower leg would go to right here. And that's would indicate 135 degrees of flexion, and that's full normal range. And then now in this lady, she's right at 95 degrees of flexion, which is significantly below normal. And you can see just, what I like to call the lipedema lusciousness. The excess tissue is preventing this, just simply preventing that knee flexion. And that is, I'm going to go into how that impairs mobility. But so first off, the surgery improves the knee flexion. So just taking the bulk of the lipedema tissue, I mean, you can pretty intuitively understand how just decreasing the size of the thigh and the calf are going to improve the knee range of motion. And we saw about a 10 degrees. So back up. Sorry. We saw from the prior to surgery, it was about 116, and after surgery 125. And similarly on the right knee, it was 115, and before surgery, and then improved to 124 degrees. And they also improved the knee alignment. So that's the from a frontal plane, if you're completely straight, that would be 0 degrees. The lipedema lady started at 6 degrees on the right and left, and that improved to 3 degrees out of alignment after the lipedema reduction surgery. And that takes pressure off the knee joint, improves also the mechanical forces in the knee, so that can maybe delay or prevent arthritis from occurring. So and then we also measured their gait, and their gait improved significantly. So this is I kind of mentioned how, like, so your average lipedema lady is somewhere around between 115 degrees before surgery, and they improved close to normal at 135, and with the surgery, and that makes a huge difference. I mean, certain things like, getting out of a car or out of a bathtub require that full 135 degrees. And if you and then the lady I showed you there, that, I mean, she was below 100. So that at below 100, you're going to have trouble going up and down stairs safely. And that is so a lot of ladies with lipedema are unsteady going downstairs. And Trish, you shared something with me about that. Can you elaborate on that? Yeah.
Absolutely. Yeah. So, I used to, when I had my knee pain, going downstairs, we always called it the crab walk, because you would go downstairs, and feel unsteady, and things like that. But, even after my first surgery, my mobility and my knee pain almost went away, probably about 75% of it. And then, after my third surgery, I have no pain in my knees anymore. I was able to cross my legs. I've not been able to do that before, and just feeling the difference, and not having the heaviness by your knee, has been such a tremendous aspect of this fact. And I just recently, last week, went up 10 flights of stairs, and didn't have any pain.
Wow, that's great. So you were telling me, like what I see, and I just noticed this, that ladies with lipedema, because we have stairs in our office, we do that in part of our exam, and they would turn sideways as they came up and down, instead of, like everybody else, go straight up and straight down, but they would turn sideways. And so and this all makes sense, if you feel like you were saying you felt unsteady
Mhm.
going down the stairs, and it is, I mean, that is, if you have limited knee flexion,
Yes.
that's a risk for falls, and you're not crazy, you are
Right.
unsteady, and so you're, and it's I mean, it's not a small thing that you're
Right.
able to go up and down stairs safely and without turning and twisting. Yeah, I mean, that's huge.
Absolutely.
That means that makes such a difference and to so many,
It
and
does.
so many women like you, and means so much to me. So this is so we use this in all my patients. We administer this promise patient reported outcome. It's a highly validated tool and used in clinical research to and so what's beautiful about this is this same tool is used to study multiple diseases and treatments. So our the women in with lipedema started at 40 below, that's 10 points below um, uh, um, the normal range, and increased to 46. Now that change, that's a 16% change in the T-score, and that's highly significant. I mean, a minimally clinically important change would be like 1 or 2 points, not, and 16%, 6 points or 16% is a huge change, and that we're going to get into what that means in real life more, but that's a powerful thing, because when we can use that same because these are used in like total knee replacement or orthopedic literature, this kind of improvement is double to triple what the improvements in mobility that is seen after a total knee replacement, which is, I mean, insurance companies are pay for every day, and is people expect, if you're having that end stage arthritis, and that there's no question that gets done, and yet we sort of don't give the same kind of support to our ladies with lipedema. So here is this is the promise individual questions. We're looking at the individually, one question was your ability to walk at a normal speed, and that increased 16%, and then also that goes along with our other mobility measures that we saw on the knee, and also correlates with this increased ability to run at a short distance, or these sort of things. These measures, again, because promise has been used to correlate with actual objectively measured walking velocity, stair ascent, and these things, then those specific things are also correlated with uh, risk for becoming disabled, and even risk and even mortality risk. So an improvement. So your improvement in walking speed, improving 15%, means you're 15% less likely to become disabled from your lipedema. And an ability to go up and down stairs at a normal pace by 18%. I mean, that also correlates with less likelihood of independently correlates with less likelihood of disability, and also getting up out of a chair. All those things are strongly correlated with that, and those are, I mean, that's powerful stuff. I mean, these are pretty remarkable improvements. Well, now we get back to you, Trisha, and this is Trisha's legs before and after surgery, and you can see here that they're smaller, and maybe you can do you have anything to share on that, Trish?
Yeah, absolutely. And I believe this was only after one surgery.
Right, that was after just one surgery.
Yeah, and then the interior, and you can just see the heaviness up top. There's a gap there, and that's huge. It just I just can't express enough, how much this surgery does really improve, and it's all about your mobility and getting your just like he said with the promise, getting that back, and in reducing, that quality of life, and giving you that energy back. So, this is just after one surgery, and the benefits of going through the entire process is just only going to benefit you, and your mobility.
So this is one of my final slides here, is just kind of putting it all together. So, you start with a proper diagnosis of lipedema and awareness, and working on the non-surgical things, the improving the diet, the compression. And then here we go through the so you're coming here, and then you have the surgery to reduce the bulk of the lipedema tissue and decrease the inflammation by that way. And then you continue the lifestyle changes and the compression and keep it at bay. And that's the full picture. That's putting it all together. That's that I believe is what's going to give lipedema ladies the best life. Well, I want to thank everybody for their attention. This was awesome. Thank you, Trisha, for sharing your story. You were how I'm so grateful for you to
Absolutely.
do that. And yeah, and then I'm gonna just, and here are the answers. Question one, when was lipedema Awareness Month started? It was started, the month of June was designated by for lipedema awareness in 2016 by the Lipedema Project. And then can compression reduce the size of legs in lipedema? And yep. And the answer is yes. Of course, if you were paying attention, you got that right. Well, thank you everyone for your attention, and I hope this was of some help to anybody, and wishing everybody the best of health. I'm signing off now. Thank you guys for your attention. Thank you, Trish.
Absolutely.
Okay, bye-bye.